My name is Jenna Downey, and today I'm going to be talking about the stigma surrounding mental health treatment today. According to the National Alliance on Mental Illness, 1 in 5 Americans suffers from a mental illness, but only around 40% receives treatment for their conditions. With the World Health Organization reporting a 25% increase of depression and anxiety worldwide since the start of COVID-19 pandemic, it is more important than ever to seek mental health support and receive treatment. So why is it that not many people are getting treatment? The culprit: stigma surrounding mental health treatments. The long answer is much more complicated than this, but as I will cover, other factors such as treatment availability are largely affected by the stigmas that exist today. So, what is a stigma? A 2014 study published in the Journal of Health Psychology and Behavioral Medicine defined stigma as quote-unquote negative attitudes held by others. The study concluded that stigma is a primary reason that people do not seek treatment for their mental illnesses. Quote, negative views of treatment and shame related to experiencing mental illnesses may preclude adults from seeking treatment. There are 3 kinds of treatment that affect those with mental illnesses. The first, which is public stigma, is, quote, the phenomenon of large social groups endorsing stereotypes about and subsequently acting against a stigmatized group, in this case, people with mental illness. The second kind is self-stigma, which refers to the, quote, loss of self-esteem and self-efficacy that occurs when people internalize public stigma. The last type is label avoidance, or those who, quote, do not seek out or participate in mental health services in order to avoid the egregious impact of a stigmatizing label. In today's world, there are a variety of stigmas about mental health treatment. One common myth is that mental illness is a sign of weakness. In reality, people do not have the power to choose if they have a mental health condition or how it may affect them. Instead, the fact that it takes strength to accept help for one's mental well-being should be acknowledged. Anyone can develop a mental illness, but it is how one deals with it that matters. Another common stigma is the belief that therapy is a waste if medication can, quote, fix one's issues. The reality is that treatment for mental illnesses depends on the patient. For many, therapy is an essential part of their healing process, whether that be with medication or not. It is important that individuals are open to going to therapy because it may be an essential part to their own recovery process. Similarly, therapy is seen as a solution only for those with serious problems or in a crisis or experienced a breakdown. In actuality, therapy treatment can help people with a variety of needs, from common mental health conditions such as depression and anxiety to managing things like grief, trauma, and everyday challenges that we experience in life. Despite what stigmas tell society, mental health treatment is an essential part of building a fulfilling life with a mental illness. To get some more insight into how stigma affects mental health treatment, Dr. Patrick McElwain provides his own takes and advice on how to combat the effects of stigma. Dr. McElwain touches on his own experiences understanding stigmas that others have inflicted or received with common public stigmas, saying those who receive treatment are, quote, weak, a loser, or a failure. Self-stigma internalizes these ideas and labels, causing individuals to, quote, ignore, push through, along, or hide their mental health and addiction. People who let stigmas control their treatment hope that their mental illnesses go away on their own or try to manage them alone. Dr. McElwain continues, giving advice to those who experience mental health stigma. First, he suggests taking a deep breath when hearing stereotypical or derogatory things about someone who has a mental illness. The anger and sadness that one feels after hearing something like that can be extremely disheartening and overwhelming, so it is important to take a breath before making any further decisions. Unfortunately, many do not understand or have the proper knowledge about mental illnesses, treatment, and recovery, so comments are often said out of ignorance and misinformation. Second, he emphasizes the importance of going to therapy. If financially possible, therapy is an important part of preventative care as it strengthens coping skills and problem-solving skills. He says, quote, If you have tried therapy in the past and did not have a great experience, please do not give up. Keep looking until you find the right therapist for you. It could be a game changer. If I go to a restaurant and have a bad meal or bad service, I may not go back to that restaurant, but I will continue going to different restaurants. The same can be said about therapy. You may have an unpleasant experience, but instead of saying, "I'm done, therapy is not for me," continue until you find the right one for you. There are so many excellent therapists and psychologists out there waiting for you to contact them. End quote. Dr. McOwen also encourages those with mental health concerns to attend support groups or use resources on the National Alliance on Mental Illness as a way to combat stigma whilst receiving treatment in a different means than traditional therapy. Support groups are a free service that helps prevent the feelings of loneliness and disconnection when coping with a mental disorder, while also strengthening how one feels about themselves and their disorder. Similarly, the National Alliance on Mental Illness offers support groups and events that are focused on, quote, reducing stigma and increasing connection and support for those impacted by mental health concerns. He ends with the importance of remembering that those who are receiving treatment for their mental illnesses are resilient, strong, and empowered. We are not who we are because of what other people say we are. There is bravery and strength in receiving treatment. Stigmas can also be perpetrated by healthcare providers. Studies show that patients that can sense a stigma leads to feeling marginalized, dropping out of treatment, or not getting treatment at all. Combined with internalized stigma, patients who experience provider stigma are more likely to feel disempowered and be hesitant to start or continue treatment. In psychology student Maya Nalpal's case, she observed that her professors and colleagues often perpetuate stigmas and stereotypes when discussing and treating those with mental illnesses. She says, quote, people in her field sometimes use judgmental language when talking about patients. We don't always notice that we're doing it, but it has a big impact on the way we think about and interact with our patients, end quote. This devaluing and discrimination at the hands of healthcare providers discourages patients with mental illnesses to continue treatment or seek a different provider. Also important to note is how racial and ethnic minority patients are impacted disproportionately by mental health stigmas. Due to historically biased systems, measurements of suffering for these groups tend to be inaccurate. Mental health stigmas dissuade minorities from seeking care and reporting symptoms in the first place. In many cases, when they are, misdiagnoses are common as a, quote, result of long-time racialized diagnosis biases. For example, Black Americans are more likely to be diagnosed with schizophrenia than white Americans. Only recently did the psychiatric community begin to address these issues, but stigma still controls the diagnosis and treatment of mental disorders. So, why is getting treatment important? Treating and managing mental illness helps improve quality of life. Treatment allows for symptoms to be managed and coping mechanisms to be learned, with overall well-being following behind. For example, improved mental health through treatment can lead to improved sleeping skills, immune system, lower pain levels, and higher productivity levels. Essentially, life does not have to be hindered by one's condition. Feel ready to get some help of your own? Temple University offers an array of mental health services readily available for students. Tuttleman Counseling Services offers free support for those seeking help for emotional, vocational, substance abuse, and other concerns. They offer one-on-one sessions, support groups, and education programs. By visiting counseling.temple.edu, you can access services, take a wellness assessment, and access emergency contact information. Temple students also have access to the Wellness Resource Center, which, quote, provides wellness education, resources, and preventative services to help our campus community flourish. They offer a variety of events over the course of the semester, all centered on wellness and well-being. So, again I say, don't let stigma prevent you from getting help.